Obesity is defined as an accumulation of excessive amounts of adipose tissue in the body and is the most common nutritional disorder in companion animals. Obesity is usually the result of either excessive dietary intake or inadequate energy utilization, which causes a state of positive energy balance. Numerous factors may predispose an individual to obesity, including genetics, the amount of physical activity, and the energy content of the diet.
According to the CDC, approximately 1/3 of adults in the United States are obese, and the trend towards obesity appears to be worsening. In humans, obesity is based on the individual's BMI, or their body mass index. A high BMI can lead to increased risk of cardiovascular disease and an even increased risk in certain cancers, and the risk in companion animals, especially dogs, is no different.
Veterinarians are noticing a corresponding increase in the prevalence of dog obesity, as much as 22 to 40%. A collection of works defines obesity in dogs as being greater than 30% of their ideal weight. Just as in people, obesity in dogs is associated with various health problems such as diabetes, hypothyroidism, osteoarthritis, cardiopulmonary disease, hypertension, and various types of neoplasia such as mammary cancer and transitional cell carcinoma of the bladder.
In 2009, Dr. Denise Schwartz reported that 67% of obese dogs had a systemic arterial blood pressure above 160 millimeters mercury, and these dogs were considered hypertensive. Their heart rates were found to be elevated, and this is thought to correlate to a dysfunction in the hearts of these dogs. These associated conditions negatively impact the quality of life and longevity for our overweight canine companions and dramatically increase the cost of their veterinary care.
Obesity is a growing concern in companion animals, and the increasing incidence appears to be mirroring the trend observed in humans. Humans that are obese themselves do not have a grasp on the risks or even the causes of obesity, and these problems can be seen in their pets. In a study in 2009, researchers found that obese dogs were twice as likely to have obese owners.
Studies show that oftentimes owners do not even realize when their dog is overweight, and they are unsure of the normal weight of their pet. People tend to baby their dogs into obesity, allowing their pet to partake in human-like behaviors.
In a study in 1988 in Munich, dogs that were allowed to sleep in the same bed as their owners and be present at meals were found to be overweight more often than those that did not have these opportunities. This same study also found that socioeconomic class may have a factor in the obesity levels of dogs, and the more money that their owners make, the more the dog will eat.
In 2010, a team of researchers found that owner age may play a role in dog obesity and that older adults tended to have more obese dogs than younger adults. In conclusion of our findings, overhumanizing dogs by their owners is the #1 cause of dog obesity. Direct correlations can be made from the behaviors of the owners in their diet and lifestyle to the obesity and health of their dog. The main concern of obesity is the many disease associations that accompany the adiposity. The need to increase awareness within the owner community should be a top priority for veterinarians, both for the sake of the dog's health and for the owner's health.
Obesity is very treatable, and the benefits are tremendous in terms of quality of life and longevity. Owners have access to diet dog foods and portion control. Also, increasing the amount of physical exercise the dog receives daily can reduce the risk of obesity and benefit the overall health of the dog.
America's problem with obesity has grown to such epic proportions that it's affecting the animals. According to a new study, the majority of adult dogs and cats in U.S. homes are overweight or obese. Yes, it's entertaining to watch a fat French bulldog spend 3 minutes trying to roll over, but it's also a little sad. The Association for Pet Obesity Prevention reported that 53% of adult dogs and 55% of cats were classified as overweight or obese by their veterinarians, and that reaching such levels of fatness can shorten their lives by as much as 2.5 years. Obviously, the solution here is simple, that conveniently can be applied to all human members of the household. Smaller portions of food, more exercise. If you have a dog, the exercise part obviously means taking it on a daily walk. And since it's physically impossible to leash and walk a feline, here's some ideas for slimming down a fat kitty. Hold your cat down and make him walk on an underwater treadmill. Chase it. Set up a ladder and create your very own kitty stairmaster. Or encourage it to hustle up and down the stairs. If all else fails, get a personal cat trainer.